Hello, hello. Not sure who's on as yet, but if you're on, introduce yourself and tell me where you're coming from. Are you in the clinical lab space? And if so, where are you coming in from? What state? What country are you coming in from? Because today it's going to be another exciting episode. Yesterday, we talked about being hidden, and today we're going to talk about value. How do you create value? So let me know where you're coming in from. Hey, Courtney, glad to see you. I'm excited to see Courtney. Who else is on? See where you're coming in from. So I know if you're lab folks, you probably hear 70% of data that's needed for diagnosis comes from the lab. We say that a lot. And then we ask, why is it that we're not seen as valuable? Hi, Anthony. Nice to see you. Anthony Reed coming in from VA. So we're going to continue the conversation, but today we're going to talk about value. We're going to talk about value. And I know usually when we go live, this is my second LinkedIn live. When it goes live, it takes a while to alert people. But I just want to go straight into it. I don't want to waste a lot of time. But if you're coming in from other areas, you just want to make sure that others know where you're coming in from. If you're a clinical lab professional, you can kind of get to know each other or even connect with each other later on. Yes, Deneen. Deneen, are you in the healthcare space? And I know Courtney is a labs manager. Anthony, you're also, I looked at your profile, but I'm not sure. I know you said the lab, because of the lab, you are alive today, and that's awesome. And some people really know more about the lab than others. So today we're going to talk about value, and 70% of all data for diagnosis come from the lab. We hear that a lot. And for some people, that's meaningless. And even for some people in the lab, after a while, they're like, so what? How is that not helping us in any way? So why is it that some people or some groups of people are more valuable or seen as more valuable than others? And you can interact in the comments if you have an idea. Deneen is in the healthcare sector. Why is it that some groups of people are seen as more valuable than others? Yeah, yesterday we talked about you are an important part of the whole, but what does that mean? Does that mean that we're all equally valuable? Are we all seen as valuable? Because I know that not all people are seen as valuable. Not all people are seen as the same. Not all people are valued the same. So I know that there's this story that I hear a lot. And there was this printing press, and some people change it from not a printing press because some people can't relate to a printing press. But there was this huge printing press that would print newspaper, and most of the advertisement in those days came in the newspaper. So the newspaper got a lot of their income from advertisement. And this huge printing press broke down on one of the most on a holiday where most people were actually putting in their advertisements, say for instance like a Black Friday. Broke down, and they did everything that they could do to get this printing press working, and they couldn't. they were calling everyone, and they decided to call a retired printer. And you may know that story, but for those who haven't heard the story, they called this retired printer who was very familiar with the machinery. And he came in, and when he came in, he looked around, and then he just opened one of those box that control the printing press. And he looked around, he went in his pocket, took out a dime, turned a screw about a 1/4 inch, and say, go check. And all the printers were up and running. And so he left and he gave them a bill. And when he gave them the bill, it was $10,000. And even though they were desperate and they were like, we'd pay anything to get our printing press going, because that's all of our income, they started questioning the bill. And they were like, look, he just turned this little screw with this dime a 1/4 inch, and he wanted to charge us $10,000. So they were like very hesitant, even though before, when it wasn't working, they were willing to give anything to get it working. So then they started, they're like, can you just itemize this bill, because all you did was just turn a screw. And when he sent the itemized bill, it was $1 to turn that screw 1/2 inch, and $9,999 to know what screw to turn. Anybody have heard that story before? So basically, the moral of the story is knowing what screw to turn, but not necessarily so, because the way you are valued is based on the market, based on the people that you serve. They determine the value, and they almost devalue this guy based on the fact that he just turned the screw 1/2 inch. And that's what we experience as clinical lab scientists, where we feel as if we offer so much, but we are undervalued. And, how did he convince them that what he knew what to turn, that was $9,999. And that's what I took away from the story. Not so much, it's more about educating the market about we knowing what needs to be turned, not the fact that it may seem easy, or not the fact that, because a lot of people may say, you get value based on the amount of work you do. But that's not true. If we look at the McDonald's, or we look at other areas that produce in bulk, it's not the amount of work that you do. You don't get paid by that. And then there's another group of people say you get paid by the problem you solve. And then I am here to kind of disagree with that also, because if people don't know this problem you solve, your perceived value could be different, because his perceived value was based on the fact that he turned that screw for that 1/4 inch turn for that screw. So many times the market may have the wrong perception of what your value is. And so he had to educate the market about his value, the fact that he knew what screw to turn. And that's what I got out of that story. And so how can we, as clinical lab professionals and other professionals, educate the market so that they understand that we know what screw to turn? And I know for a lot of people who are in the lab, they're like, I don't feel comfortable getting out of my comfort zone to educate the market. But in healthcare, when you think about the big initiatives that are in healthcare, there are things like that Medicaid and the government will pay big bucks for. Things like sepsis measures, things like stroke measures, things like central line associated bloodstream infection. How long does the patient stay in the hospital? And we have so much to do with that, but many people don't know that we do. And so, how do we educate the public that we can contribute by saying what is needed to be done, not so much what we do? We're not only just pushing the buttons, but we know what needs to be done. Let's see. So Deneen is saying that's really interesting. Hamad is saying, I agree 100%. We have all the opportunity to express our value. Hamad is saying value to expertise, to experience. And Deneen is saying be the subject matter expert. And that is so important. Yolanda is on being that subject matter expert. So if we are not seen as the subject matter expert, if we are not seen as the one who knows this, where to turn, the perception of the market is so important for the market to have that perception that you are valuable. So I know we're all valuable in our core. Yes, we are all important. You are an important part of the whole. But there are certain things that we should be willing to do to educate. And, sometimes it's really challenging. And I wrote some steps in terms of what we can do in terms of education that I call it baby steps. And it's so important to be out there demonstrating, contributing, so they can see how we're contributing our expertise. And the baby steps that I have here is start out by just reaching out and offering to help with just a small issue so that people realize, how do you solve some of these problems? That's kind of baby steps. Like, take time to understand some of the needs that are out there in your organization. And because before you can solve a problem, you need to understand the need and be open to help and to answer questions. And then build relationship with different groups. Say, for instance, if you're a manager in the lab or somewhere else, build relationship with a manager who maybe, say, a nurse manager or pharmacy manager, and start collaborating so that they can understand the value that you bring. And then another thing that may be a little step higher is to offer to sit on a committee or a team that there's no lab people, there's nobody from the lab that's there. Because it's so important to have a seat at the table to help to contribute in terms of your education. You're educating in terms of your expertise. So like we said, like the printer expert, the technician, he basically, it wasn't so much about what he did, but was his expertise. So it's so important to be able to let people know the expertise that you have to bring to the table. So, and I probably will share this. I have another tool that I usually share, and it's helping you to guide you to take these little baby steps. So Jeffrey's saying, how has this period of COVID-19 impacted both positively and negatively on your field and areas of improvement going forward for the future? So yes, during COVID, to be honest, there has been a little bit more in terms of people understanding the lab and what we do. Not enough. People still think that when they're taking a swab, that's a test. Some people still think that when they draw the blood, that's the test. They don't realize that there's a team of experts in the background. There's a lot of scientists in the background that doing these testing. And what we're doing, we're sending back these reports to the doctor. And based on the reports that we send back, the doctor will decide to act. So basically, say for instance, like in virology, if there's a virus and they're actually, or now they're doing a lot of molecular testing. But even in bacteriology, when they decide that there's something wrong, there is something we call sensitivity testing that they can determine the drug up to the type of drug and the dosage that the doctor will use. So basically, we are the expertise that decide what screw need to be turned. What, not so much turning the screw. So we give that information on what screw need to be turned, and then based on the information we give, then the doctor decide to turn the screw. But so many people don't know that we are the subject matter expert that determine the screw that needs to turn. And that guy, that printer expert, was able to break down and educate the marketplace, educate the consumer, so they know that the reason why I am valuable, I know what screw need to be turned. And that's kind of where we fall short in the lab, because we're not educating the marketplace. We're not educating. Medicaid is willing to pay big bucks for people who help with things like sepsis. Say, for instance, sepsis measure, we have so much in the lab that we do to help to reduce stroke, to reduce sepsis, to reduce central line. Some of those big initiatives, we are part of that. But without sitting at the table with teams that are working to reduce these measures, if we don't have the lab sitting at the table and they understanding how we're contributing to that, then people won't see our value. And our value is determined by the perception in the marketplace. And that's kind of what I wanted to talk about, because even if we keep saying 70% of the data comes from the lab, without actually doing that education, without being at the table, without showing how we are the ones who know what screw to turn, then it's not going to happen in terms of value. So Mohammed is saying interdepartmental connection is very important. Working together with other groups so that other teams realize the contribution we bring is so important. And he's saying it's important to invite other departments to come to the lab to see how we operate and build that relationship. And it's so important to build those collaborative relationships. And I know for lab people, it's like, you know, we want to contribute to healthcare. But we want to contribute to healthcare in a different way. We don't want to be at the bedside. We want to be those experts that actually do these testing, and we want to be able to give those results to the providers or to pharmacy in terms of drug levels so that they can make these adjustments to medication. We want to be behind the scene, but that doesn't mean we don't want to be valued. And so that's what's causing it to be very challenging, because of where we choose to provide value. And so that's why I wanted to have this discussion today, because there's a lot of people who think that it's really about value is based on solving problems, but not necessarily so. Value is based on the perception in the marketplace. Because if I don't think you're providing value, I'm not going to pay you, and it's going to be based on my perception. Courtney, what's your thought? No, there's a lab manager here. Is Mohammed is so that's basically what I wanted to bring to you today. It's so important for us to step out, and my theme is medical labs stepping up and stepping out, and that's really challenging, but that's what I wanted to offer today. And if you come back to my comments, I don't think I pulled it up. I have a tool that will help you with those baby steps. If you want to start with those baby steps, which I know based on who we are, we like to contribute behind the scene, but also we want to be seen as valuable. All right, guys, that's basically my message today with the live. I am going to come on for, like I said, the rest of the year, because the goal is 2021, stepping up and stepping out. Courtney's saying communicating throughout the organization and advocating for a team is so important. And those communication across the organization in terms of educating people about our value at the organizational level, at the government level, at the payers level, understanding how we contribute in terms of offering our expertise in order to solve problems. All right, guys, I enjoyed this communication. I want to come on until the end of the year, and this is all about stepping up and stepping out. Thank you, guys. Deneen, thank you so much. Deneen said, thank you for sharing. Thank you. Oh, now, you know what? I'm just learning how to highlight. So I just highlighted Deneen, and that's Courtney. So now I'm learning. This is my second LinkedIn Live. Now I'm highlighting some of these comments that were in the chat. Great. So thank you so much. Thank you for, let's get Mohammed. Thanks for your engagement. And I'll be coming on tomorrow at a different time to talk about another topic on stepping up and stepping out. Thanks, guys.